Benjamin Day,
And I am Jillian Mason.
and this is Medicare for All, the podcast for everybody who needs health care.
Mm.
So today we are venturing into the truly bizarro world of Medicare, especially Medicare prices and what Medicare covers, to explore the largest Medicare rate hike in history of the program, which has been happening this year, 2022. And we are joined by Alex Lawson of Social Security Works to explain what the fuck is going on here. Jillian, do you want to introduce Alex?
Yeah, sure. So, Alex Lawson is the executive director of Social Security Works. And that organization is the convening member of the Strengthened Social Security Coalition, which represents about 50 million Americans. So, Social Security Works fights to protect and expand Social Security, Medicare, Medicaid, and also to lower prescription drug prices. Also, Alex Lawson shares really awesome memes on social media, which is why I'm most excited to have you here.
Memes day.
Mhm.
So it really is. It's just very therapeutic, I feel. Some
We're
of
gonna
them
win this
are
movement one meme at a time.
one meme at
for
a time. I
sure.
was just
Yep.
going to say, some of them are like some really great advocacy tools. They get right bypass the corporate media filter.
Mhm.
All right, that's a topic for another day, but right now we're here and we are going to be talking about this like massive increase in Medicare Part B premiums for this year. So now, of course, I am a healthcare policy expert, quote unquote. So I understand this perfectly well. Um, that being said, asking for a friend, what's a Part B, what's a premium, and what does it mean that it's going up?
All right. So just to set this off, obviously Medicare is the universal-ish public program that covers seniors age 65 and over, and some people with disabilities. Only certain categories of disabilities are covered by Medicare. Now, the hospital services are called Part A, and the physician and outpatient services are called Part B. So that's why we get this weird jargon, Part A, Part B, and there's a C and a D as well. And it's Part B that has premiums. Now, you might ask, why is that? That's a little bit weird because when you become eligible for Medicare, you automatically can enroll in Part A, but you have to pay for your premiums for Part B, just like you're paying for a private health insurance plan. And we actually did a separate video about this. The origins actually date back to Jim Crow. And the fear when Medicare was first implemented was that federal laws would require the integration of physician offices in the South, racial integration of physician offices. So they required a premium because it would then be considered a voluntary program. And they thought that the federal laws requiring racial integration would not apply. And it actually did allow physician services, physician offices to remain segregated much longer than hospitals were segregated. And the same thing happened with nursing homes too. So super racist reason that we even have Medicare Part B premiums at all.
Right.
But what happened this year is that Medicare Part B premiums rose by 14.5%. From about $149 per month to $170 per month. And the annual deductible also rose on Part B from $203 to $233. Now, just for some perspective, the Medicare Part B premium was less than $50 just back in 2000. And last year, there was like a less than a $4 increase. So this is the largest premium price hike in Medicare's history. So, Alex, this is why we've got you here to explain this for us. Why is it that Medicare rates are increasing so dramatically this year? Are seniors getting more, better Medicare? I'm sure that's the case.
Just one note that I think is interesting. The hospitals were integrated through Medicare because they didn't do that.
Right.
So,
Yep.
like the beauty of universal programs is that it works for everybody, and that's why some people hate it really a lot. I want to.
Happy Juneteenth, y'all, by the way.
Happy
Happy
Juneteenth.
Happy
Juneteenth.
Juneteenth.
It is an appropriate day to be talking about the racist legacy of our healthcare system.
And I also like sometimes, and I don't think in your audience, but some people are like, oh, what is this? We're talking like hundreds of dollars, like, well, what is that even, What happens for an enormous percentage of Americans is that those premiums are deducted right out of your Social Security check.
Right.
So it's actually your Social Security check lowers.
Shrinks. Yeah.
And what I think sort of goes over, especially senators and representatives and rich people in
We're all
DC,
millionaires. Yeah.
is that what we're talking about, people who live on $19,000 a year,
Right.
$19,000 a year, and it's fixed. That's
Mhm.
it. That's the average. But like each check, you're not getting anymore. There's no wiggle room there. So when
you can't
you
get
are,
a raise on
you
Social
can't get
Security.
Yeah,
right. We
right.
have automatic cost of living adjustments, but what you're getting each month, like for a huge percentage of Americans, that's it. So these cuts are hugely significant, and
Mhm.
they're aimed at or they impact some of the most vulnerable people in America. And then when you get why they happened, you're just remember $19,000 a year. There's
Mhm.
one company, pharmaceutical company called Biogen, who
Ooh.
they staked their entire future on one drug called Aduhelm. And this happens in the pharmaceutical sector. Aduhelm as a molecule is a failed drug. It's failed. But they were like, we can resurrect this drug through marketing and corruption. And then they went after it with everything they've got. And what they've got is almost unlimited money. So they corrupted the FDA like in ways that we haven't ever seen before. And we've seen the opioid crisis where the same person, her name's Janet Woodcock, waved through heroin, Oxycontin, and was like, oh yeah, this is non-addictive heroin.
And Alex, can you really connect the dots between this drug and the Medicare price hikes? Like,
sorry,
how did one cause the other, and how much does it
So-
actually account for the rate hikes?
The way that premiums work in like anything is an actuarial projection, right? So you say, this is how much we spent on services last year. So we're going to have our population pay, X dollars. And then if there's a new thing, you say, okay, well, this many people could take this new thing and it costs this outrageous amount. So when Biogen launched it, I can't remember what the launch price was, but it's like it's close to 60,000, was
It
it?
was
A year.
56.
Yes.
Yeah.
56.
For one person. Yeah.
Yeah. And which is just like mind-boggling, right? And importantly, the whole population of Medicare under the corrupt approval it was anybody who potentially could have Alzheimer's with like the barest of clinical like doctors basically couldn't say no, right? And so Medicare, CMS has to look at it, and that when they did the math, they're like, okay, well, we're going to have the largest rate hike in the history of the program because of one drug, because of one company. And this drug is not only does it not work, every expert panel that the FDA had, every doctor, every group of doctors and experts were like, do not approve this drug. It's a failed molecule. Not only does it not work, it's harmful. It actually causes brain bleeds and death. So
something like 35% of people in the clinical trial who took this drug experienced edema, which is brain swelling.
Right.
35%.
That's really bad.
And it like, it's really hard to get into the like soullessness of what goes on this. Cause like, again, it's this company who's reaching into people who they average $19,000 a year. The CEO, needed another golden yacht, so he's going to rob them. And the tool of robbery is a drug that actually is going to kill a bunch of them as well. And to do it, they corrupt the FDA at a level that's insane. They got corporate advisors working alongside the FDA to guide it through the approval process. And you're like, that's not how it's supposed to work.
So this is actually going to affect potentially all of us, right? Because the FDA is approving drugs for the whole country. That means that this drug can be prescribed for anyone if it's covered by your private insurance. So there was a two-phase thing, right? There was this corrupt process you were talking about to get through the FDA, and then there's a separate question of does Medicare cover it and do private insurers cover it as well?
Right.
Yeah.
And there's multiple things like does the VA cover it? And that was one of the first things. The VA is like, no, we've just followed the science, and absolutely not. The VA,
and that's the Veterans Administration, right?
And the Veterans Administration, which is socialized healthcare in this country. That people aren't excited about healthcare in general. But when you ask them, do you like the VA? Everyone's like, yes, I love the VA. It's super popular. It works really well, negotiates every drug price every single year. So remember that the next time they say it's too hard. The VA, I think there's like 12 people in the whole office that does this. They negotiate every single drug price. So we know it's possible. And there's like so many things here, as you know. I'm very... I get really angry.
You seem a little emotional, Alex.
Yeah. But there's villains, and you're in the political arena, and then there's like fucking garbage people, like the CEO of Biogen and the board and everyone who signed off on this. There's nothing I find more despicable than people who are selling snake oil to people who have basically no hope. I want you to think of people in your circle, in your network, who have dealt with family members with Alzheimer's. It's the worst fucking thing that any family can go through, and these corporations know it, so they pretend they can help. And they imagine the turmoil of a family who is sold that this thing is maybe a cure for the worst thing that's happened to their family, and that's what they relied on. And it was not about medicine or healing or anything other than money. It was just money. And every medical investigation made it really clear that this molecule is just not worth pursuing.
So if I could just just try to summarize this for the folks who are keeping score at home, right? So we've got Biogen wants to make huge amounts of money, right? So they decide to collaborate with the FDA, corrupt the FDA, right? In order to get this drug approved, right? The FDA approves the drug, and now we're all paying for it.
Right. And then I forgot that's where I was supposed. Ben asked me this because the bureaucracy, like when you're in the fight, you're like, it all makes sense. But like, no, none of it makes sense. So I got to remind myself that like you have to explain this. So now there's another thing that happens, which is CMS, Center for Medicare Studies, right?
Services, Medicare and Medicaid services. Yeah.
And CMS runs Medicare. So under HHS, which is all healthcare, CMS runs Medicare and Medicaid. And CMS has to wave through the drugs. Like, is Medicare going to cover it? And what they do is they follow the FDA, because the FDA is the gold standard. But this was so out of bounds.
Right.
That CMS did an unprecedented thing that was incredibly brave. And I want to stand up for the professionals who, dedicate their life to making this silly system we have at least function somewhat. And they stood in the way of all of the power of pharma and the corrupt politicians who dance to their dollars. And they said, we're not going to cover. I mean, I shout out the VA really early because they didn't even give it. They were like, nope, right off the bat. And that was really important for giving CMS the ability to also say no, because, they were like, we're looking here. Most private insurers also are, limiting it extremely because it's just not there. So CMS, it was very brave for them to do it. But along the way, they also greenlit the premium increase because, maybe they were worried that it would get overruled, or, generally there's just the small c conservatism of bureaucracy. They wanted to have the money in hand. Now, when CMS actually went over the top of FDA, it was really clear to all of us who've been working on it in the trenches, like everyone, we just were like, oh, great. Well, now they'll give the premiums back because the premiums only
that rate hike
went up
was premised only on this drug, right?
on this drug, which it's not going to cover anymore. So we were like, this is going to also be a political win for Biden, which it should be. Because he was, and Becerra, Javier Becerra is the secretary of HHS.
I've heard that seniors vote.
At seniors vote, this was like a slam dunk. It made perfect sense. Like, I stood up for your health, face down the drug corporations. And by the way, sorry we took out more money, but it wasn't us. It was the greedy pharmaceutical corporations reaching their hands in your pocket. Here's a check. But instead of doing that, they went on TV and they said, I'm sorry, it's too hard to lower the premiums. And I'm like, what? We all expected this to be a win. We were like lined up to be like, okay, in the face of all the other things, like, let's try to celebrate the little victories. And when the administration does the right thing, we were lining them all up. And then it was like, God damn it, you did the wrong thing. It was so easy. It was a slow motion layup on a bunch of kindergartners. Like, that's how easy the play was, and they still failed. I will say it's not over, and we never give up, but it's just mind-boggling to me. Why not take the political win?
One thing about this that really struck me was that so the FDA approval of the drug was actually conditional on Biogen doing another round of trials to actually see if it works, right? Which itself is wild. Like,
which it doesn't. They've done trials and it doesn't work.
Right? Yeah. So that being said, right, Medicare is actually going to cover the use of the drug in clinical trials, right? So basically, we, the taxpayer, are now paying for Biogen's clinical trial, right?
So two things on that. One, the CEO of Biogen was fired right after all this. There was the whole Biogen. So like the board, all the rich people who they were like, okay, this play is done. So I'm not saying that Biogen is all of a sudden a good guy, but this play is pretty much over. And like the idea that you could get this, that Aduhelm could be prescribed widely. I also will say, like I said, it's a garbage molecule and all of that. And it is. But like Vioxx, which definitely killed a bunch of people, and there were safety concerns. Oxycontin, which definitely killed a bunch of people, safety concerns. But there are populations who those drugs are clinically the exact right thing to use.
At least it works for some people, right?
But we should keep investigating. And if there are clinical trials that are rigorous, that are, actually well-designed and people want to, with informed consent, be part of them, I think that is appropriate. That's an appropriate use of a molecule, because there could be situations where it actually works, and you have to keep trying to look for evidence. You have to keep the scientific process is iterative. So I don't think that it's a concern that it is a very narrowly approved. It's really rare, like thalidomide and other ones. Thalidomide. But that's the FDA. The FDA they made the right call back in the day. Sorry, I won't go through arcane FDA history, but that's why we used to be the gold standard. We were the ones who didn't let bad molecules through, and other people were a little bit more loose.
That is what the FDA is there for,
right? In
theory, right? But it's become a super flawed process that the pharmaceutical industry has been able to capture partially.
It's literally the like neoliberalism of it is just dripping. It's like, instead of the public institution actually understanding that who they work for are the people, and that industry is not they switched it so that industry is who they work for. And they not everyone, but like Janet Woodcock, who we did get fired, so that's great. But she saw her job as shepherding industry innovation into the marketplace. And there's all sorts of public times she said, like, well, why would a corporation put something unsafe on the market? And you're like, money, right? Around.
Right.
What? To make a profit, to make a buck. These are soulless villains. So here's my thing. It strains every ability of mine to like give the benefit of the doubt when government's like, oh, it's too hard to give seniors whose money we took, right? It wasn't too hard to take the money, but it's too hard to give it back.
It's so hard. I have a hard time giving money to people too, I find. It's really, really hard. I try. I'm like, God, I just can't do it.
It's very difficult.
I'm sorry.
They say, so here's what they actually say. So CMS and HHS actually, so Secretary Becerra made the announcement that lowering the premium going forward is too hard in the middle of the year because of the way that they're calculated, basically, like the actuarial projections. So we're going to wait until next year to actually work it into the next premium rate increase. And possibly the rates will go down in the future, which is just like,
what are the odds of that?
Come on. But even if you do allow that, right, you say, okay, well, HHS is unnecessarily complicated for some unknown reason. And the reason is, industry influence.
Bullshit.
Well, yeah, exactly. Just total bullshit. But let's just give them that and be like, okay, President Biden. Okay, Joe, come on, man. You know what you can do really easily, because we've seen it throughout the pandemic. You don't go to HHS, you go to Treasury, which is literally next door to the White House. Joe Biden can walk there. You get every single person on Medicare whose name you already have, and you mail them a check directly to them for the money that you wrongly took out of their Social Security check because of one drug. And then next year, you make up the dip, right? Like, okay, well, you screwed it up by $2 on Jane Doe, and you're like, all right, well, $2 next year, we'll figure that out. But in the meantime, you're just sending tens of millions of people, a couple $100 check, really easy. We actually know this from the Build Back Better fight, where Senator Sanders was fighting for a variety of things, and HHS was saying, it's too it's too hard. It's always too hard to help people. And so they went to Treasury and we're like, well, what if we could get, some checks to people to help them with some of the costs, seniors of vision, hearing, and dental services. And Treasury was like, oh, yeah, that's simple.
We could do that.
We could do that. Like, it'll take weeks, So we know for a fact that they can do that. They can send checks. It's within their purview. They've done it before. It is not hard. And it's the right thing to do, right? Like, I can come back to this one thing because like this drug is not the end, right? Like, unfortunately, Biogen came up with a play that was designed in a boardroom that was to rob the entire population of Medicare. And every drug company looked at that play and was like, genius.
That's what we're going to do.
This is absolute genius stuff here. And if they just did it with something with like slightly more clinical backing, right? Like something that didn't actually cause brain hemorrhage, brain bleeds and death, they could have done it. It means every pharmaceutical corporation can bankrupt Medicare by just robbing people of it, because Medicare, again, it's too hard for Medicare to just be like, no, we're going to negotiate drug prices. So this is not the end of any fight. And maybe no fights have an end in this political arena, right? It's just like, it's an iterative process that gets worse or better. But we know they need to return the money. And we know that a lot of things in government are based on precedent, right? So like robbing people of their Social Security check because of a pharmaceutical corporation and then not correcting it because it was too hard. Well, in 10 years, they're just going to do it again and be like, well, you see, last time the lawyers said this, and now we definitely can't do it. That's how DC works. So this
is such an American story or American healthcare story, because there's, this couldn't possibly happen with a universal healthcare system. But I mean, I think the FDA has kind of a long history of things like this-ish, of there's actually a lot of drugs that are very common out there that have just the barest of evidence that they're clinically effective, just like maybe slightly better than a placebo. I was joking to Jillian before the before the show started that next year there's going to be a massive Medicare rate hike for covering placebo. Placebo drugs, which is basically what a lot of these are. So this was but this felt like a pretty spectacular failure, even on the scale of FDA faking things. So
FDA waved through the opioid crisis. And it was Janet Woodcock who did the same thing, right? Like they literally put a special label on Purdue Pharmaceuticals opioids that said these opioids are magically not addictive, right? I mean, that's it. That's what caused it. Now it's not. Right now we're in fentanyl. I mean, like but FDA, that failure should have been like the resounding end of Janet Woodcock's career. It wasn't. That's how it took activism to end it. But she then waved through, and that wasn't the first one. We started working against her on a drug called Risperdal, which again was a failed molecule. It was an antipsychotic that didn't work, but it did actually like get people fucked up. What it is this clinically sedative, and what that meant is. This is like so evil, but that's who people should remember who were fighting. Johnson & Johnson marketed it to institutionalize children and seniors, the most vulnerable populations there are. And they did it because like in these nursing homes, institutions,
they oversedate people.
They oversedate people. Right. So they just poured this dangerous chemical down the throats of children and seniors. And the thing is, the seniors generally just died. But you're talking about 101-year-olds and things like that. So it's like, oh, well, what killed them? You're like one of many things. But the children had massive side effects. And so there's huge class actions. There was, I think, an $8 billion verdict against them, which, then they always lower it because they corrupt. But so these failures are endemic of the Janet Woodcock FDA. So I will say that, and you can reel me in, but there's two different things. Oh, my son is coming.
He can join.
He's going to say hi. Hey, Xander, can you give me just a couple minutes? You can come and say hi, but then I'm live, and then you can give me a couple minutes.
Hey, Xander.
Hey, Xander.
Thanks, buddy. He was just he was at the pool swimming, so I think he wanted to tell me about that. He's pretty good. And by pretty good, I mean really good. So
I've heard things.
Adding like a little bit more clinical effectiveness is where that's what pharma, that's their biggest con, right? So they take something that exists and they add a little bit of an inert substance, and then they say, oh, well, this thing's a new thing. And to be fair to the FDA is not super duper set up to stop that thing, right? Because the clinical significance of the underlying drug is still there, and the safety profile of the underlying drug is still there. It's just a con, and it's annoying. What the FDA is supposed to do beyond anybody else is against the other threat, which is harm, right? It's the safety profile. The FDA is never supposed to wave through something that harms people, right? And that's where this industry corrupted FDA is failing at a level that, like, I can't believe that we would even, she was acting FDA commissioner for the beginning of Biden's presidency.
And tell me, I feel like the FDA hasn't changed dramatically under Democratic versus Republican administrations, has it?
It has not. And that's that's what makes me, feel like I'm taking crazy pills is after
Big Pharma is like the president of the FDA.
And after these catastrophic failures to just be like, they'll probably get it right next time. And you're like, what? They're definitely going to get it wrong next time. Like 100%. Pharma will never stop.
Yeah.
So, I mean, okay. I'm a little sad now. So make me feel a little happier. So we talk a lot about Medicare for all, right? And now we're sitting here and we're talking about how people who are on Medicare are actually getting screwed, right? How would the Medicare for all system that we're fighting for, right? How would that be different than the situation that's unfolding right now?
It would eliminate it. I mean, like Medicare for all is not the VA. The VA is socialized medicine, and Medicare for all is just a single payer. But it's one public system that actually would then be able to evaluate data. It would all be in one place. It would be mission driven. Super importantly, right in the middle of all of the bill. Of the two bills, and is that Medicare would negotiate drug prices. Medicare would not just allow pharma to set the prices at whatever they wanted.
Right.
We're using global budgets. We wouldn't let big hospital do it. We would, right? Big insurance is gone. Big pharma is just pharma. The whole system is transformed. And, you know, again, we know this from our world. You just look around at other countries and you're not seeing levels of corruption that you see in America because their systems don't allow this type of stuff to happen. No one's system is like perfect. An improved Medicare for all system wouldn't be perfect.
No other country is going to cover this drug.
Right.
No.
And what happens is, first of all, we improve Medicare. So the annoying parts of Medicare are eliminated, right? Or most of it is like there's additions, right? There aren't any more. We don't need to worry about the premiums. We don't need to worry about Part A, Part B, Part C, or Part D. And under C and D, there's also about like 100 sub-plans there, which is super annoying. There is no more Part C or D. It's all just one system. We add vision, we add hearing, we add dental, right? All of the parts of Medicare that are missing because of industry, because that's where they make their profits, they're all gone. So like this doesn't happen under a universal system. There will be failings, and we can look at other countries and see failings. We can see how, you know, universal systems fail, but I'll tell you how they don't fail. They don't have 30,000 people die a year because of lack of health insurance, right? Like they never fail in that regard. They don't fail in having medical bankruptcy be the number one driver of bankruptcy in America, right? Like they don't do that. None of those concepts exist.
Yeah, there's also no country with universal healthcare that had the highest rate hike in history because they don't have premiums.
Right. No premiums,
right.
No deductibles, no copays. All of the stuff that's wrong with the current system is eliminated in an improved Medicare for all. And I think it's just like, it sounds so good that I think people don't believe it. And you're like, you don't understand how much simpler the system would be as well. You don't understand how complex this machine that we built to extract money for Wall Street and industry, it is massively simpler. And so all of the inefficiencies that come from these different layers, like talk about bureaucratic. I mean, like anyone, have you ever called your insurer and tried to like figure something out? Yeah, that's bureaucracy.
Jillian has done a lot of that lately, actually. I think.
It's the worst. If you're a small business owner,
if
you're a small business owner trying to get your employees healthcare as part of our job here, and you're like, it's actually, in my opinion, as a small business owner, it's the most frustrating part of being right. You're like, why do I also have to figure out providing healthcare? What a dumb system we have in this country. Sorry, Jillian, I cut you off.
Oh, no, I think I was just going to talk more about how much I hate insurance, but you pretty much covered it. So that's great.
I thought there was a telling moment in this process, too. You alluded to it briefly, Alex, but when Biogen first released this drug and, you know, they did all the clinical trials and they said, oh, the clinical trials failed. Then they're like, well, no, let's take a second look at this data and reanalyze it. And this is where they found, you know, maybe there was a slightly better than the placebo on one of their trials, not all of them. But initially, when the FDA was going to approve this, they said, all right, the drug is $56,000 a year. And then it turned out that was going to be catastrophic for Medicare and for private insurance companies. And they're like, oh, this this could go very poorly, especially given that it doesn't work, the drug. So they said, all right, we're going to cut the price in half. They just decided, they just said, oh yeah, you know what? We changed our mind. It's not going to be $56,000 a year. It's going to be whatever, $27,000 a year. And that's just like, you know, the pharmaceutical company should not be able to make that decision for us. Like, is this going to be $60,000 a year, 30? Just throw it. It's like funny money. You can make up any number you want. That would never happen in another country, even if they were covering this drug.
Xander wanted to throw in. He hears my fire at pharma, and he's like, I don't like.
I hate pharma too.
He's not there, but what he says is everybody should have healthcare. It's just like, I mean, it makes so much. He's like, anybody who gets sick should get any care they need to get better. That's obvious, isn't that? Why don't we have that system now?
Oh my God, kid logic.
You want to know, and I think it's sort of obvious, but just in case it's not, you know, they plan that. They plan the price decrease, right? So they come on and they're like, oh, well, this garbage bill costs $120,000. And then there's all this outrage and they're like, oh, we're a benevolent company. We're actually going to reduce it by 50%. Now it's only $50,000. And then
it's a marketing scam.
It's a marketing scam, and corporate media oftentimes falls for it. And then the pressure is used, like the goodwill that buys is used to take the pressure off of them from, you know, from government, from the public. So these high launch prices are not going anywhere. This exact scenario is going to happen again, but probably more sophisticated, meaning that it's not going to be a drug that kills people, or, you know, right? Like that. That was the thing that really did this. If it had just been a like less, you know, like a slightly more effective something, and they were like, oh yeah, it costs $100,000, they're gonna be able to just pick the pockets of everybody on Medicare.
So big pharma is like, these companies are all just in a race to be the next Biogen now.
Yes, that play is, and you know, they'll start it by being like, "Look, we're not the next Biogen here," and you know, you are,
right? Yeah.
And the only thing that will stop this, literally, the only thing, is moving to Medicare for all. Like the only thing that will just end this system is moving to Medicare for all. So until we do that, it's just going to be one bare knuckle fight against industry after another.
And it's hard to win those too. Yep. So I had one. Well, we shouldn't overlook the partial victories here, right? I mean, the FDA approval, that was an epic failure of the entire system that's supposed to protect patients. But as you said, Medicare essentially saying no to this drug. They're going to cover clinical trials, but they're not covering the drug, is a win. And actually, many private insurers are also doing this. I saw that the Cleveland Clinic, a lot of providers are saying we're not going to administer this drug, whether it's covered by insurance or not. So there is a widespread, like, no, we're calling bullshit on this.
And the condemnation from the administration, from champions in Congress, from actually like kind of wimps in Congress, right? Like the fact that there was so much noise around this is something to be, you know, like whatever it is, like happy about. You're like, well, not gonna be happy until we don't have to have these fights.
Less unhappy.
And it is like we've reached that
life goals.
That terminal, less unhappy, that terminal point in the system, because it's not like pharma is going to get marginally better next year, right? They only get worse. The system only gets worse from here on out. Big hospital, big pharma, and big insurance, because they dance to the tune of that private equity calls, they're not allowed to stop delivering those outsized results, right? They're not allowed to make less money. If they make less money, private equity will kill them, and the ones who will be merciless and make more money will take their place. The system cannot self-correct. All it actually does is accelerate in awfulness. Oh, my daughter's here now too, so say hi.
Hello.
These are all future Medicare recipients, and so it's really important for them to weigh in on this.
Everyone should have health care. Children understand.
to put a bow on this, Alex, for folks who are as pissed off as we are about this Medicare price hike not being reversed, it's seniors got this, and people with disabilities got this huge rate hike, the largest in history, to literally cover something that's not being covered anymore. It was like a fake increase. For folks who are really pissed off about that and they want to see it change, to see like a rebate like you're talking about, what should they be saying to their member of Congress if they're going to call them or their senator?
Just that contact their offices and tell them that they have to get a rebate check into people's hands, that they have to lower premiums going forward, and that this is not something that can wait.
All right.
Amazing.
All right. Well, thank you so much for joining us and explaining this all, Alex. The more I learned, the more kind of I shouldn't be shockable anymore in this job, but somehow I am still shockable with each like new, peeking under the covers of like the ugliness of this whole system. So this is really terrible, but thank you so much for joining us.
Thank you. And Soraya came over to tell me something that needed to be told right then. So I didn't end in saying this is the other happiness. We have champions on this. The fight is absolutely not over. There is a lot of members of Congress who are still pissed about how this is played. So contacting members of Congress is going to be an effective thing to do right now.
All right.
Awesome.
Well, we at Healthcare Now will stay on this and let us know. We'll keep our list updated if we can do anything more about this. Maybe we'll shoot out an email to our list after this podcast. But I don't want to end before thanking our podcast team, without whom we could not do any of this. Our podcast manager is Angelique Davis. Our researcher for this episode was Lindsay Beisch. Our audio editor was Christian Brandt, and our show notes writer was Jerry Katz. So thanks to all those folks, and thanks to you all. We'll see you in a couple of weeks.
Stay safe,
Bye.
stay dangerous.